Welcome to our webinar, A Holistic Approach to Laminitis with Dr. Joyce Harmon. Today's webinar is brought to you by Docs Hemp. Hemp with CBD that can support your horse's immune system and keep him or her calm and relaxed. Docs Hemp is veterinarian approved and available in powder or liquid. Docs Hemp, your leading source of CBD for horses and pets. Now here's your host, Stephanie Bradley.
Good evening, and thank you everyone for joining us. I'm Stephanie Bradley, and I would like to welcome holistic veterinarian Dr. Joyce Harmon.
Hi, Stephanie. It's great to be here doing this webinar tonight.
And it's awesome to have you here, Joyce. Many of you may already know her personally or possibly read some of her insightful articles in national publications. For more on Dr. Harmon's extensive background, please visit her website, harmonyequine.com. I want to get started so that we leave 15 minutes for questions and answers. So Joyce, let's start with laminitis and founder. Are they the same?
Okay, laminitis and founder are in reality some of the terminology that describes the same problem. The tendency is for us to talk about laminitis as being a milder inflammation of the lamina. And this photograph showing the lamina, the healthy lamina inside the foot, it's produced by one of my friends who has anatomyoftheequine.com. Amazing pictures if you want to really understand what's happening inside your horse, not just the laminitis, but the whole horse. So we have, in laminitis, we have an inflammation of these healthy lamina, and you can see how they go nicely up and down, and they look healthy. When we have a laminitis, we start to have inflammation, and we start to have damage to these normal lamina. The more advanced phase, which this photograph really is, a more advanced chronic laminitis, we can also call founder. And with the founder aspect, we can think about having more severe rotation, more severe damage inside the foot. So here again, we have a normal hoof wall with the hoof wall being parallel to the coffin bone, which is P3. And here in a chronic laminitic foot, we have the hoof wall out here and the coffin bone actually pointing downward. In the old days, everybody called all of this founder. Now we often call laminitis the milder form where you don't necessarily have a lot of rotation, and founder the more severe form. But in truth, you can use each term interchangeably.
So Joyce, how did we get here? How did we get to this state?
There's two major ways that we get to this state where we have some laminitis. One is obviously overeating, just getting out and getting into the food. And the other is the metabolic problems that are really plaguing us and really the reason that most of you are here tonight. The overeating aspect is much simpler. Here you've got a horse that has been confined to a dirt paddock. So if somebody leaves the gate open, or as it looks like this gate got broken, the horse escapes and goes out and eats all of this grass over here. Even if this horse is metabolically normal, the transition from eating just some hay to all this lush pasture is going to result in an overeating situation. And the other aspect of overeating is the horse that gets out into the feed room and eats a whole bunch of food. And so Those cases are usually much simpler. It's a single insult, and they usually recover quite well. So those are really not our problem cases, and those are really not what we're going to be spending the rest of the evening talking about. So our metabolic laminitis cases are horses with insulin resistance, and the insulin resistance is the most common way we end up with a metabolic laminitis. Horses that have insulin levels that are high. When you have insulin resistance, we're not going to get in depth into exactly how it works, but I do have some other webinars on the website that tell us about, in much more detail, how insulin resistance occurs. And so basically, in a simple way, the insulin cannot take the glucose into the muscle cell. And so it builds up as fat. So the next way that we can have a metabolic laminitis is our PPID horses, or we've called this Cushing's disease for a long time. And the Cushing's disease, the correct terminology really is PPID, and we should start referring it to that. Pituitary pars intermedia dysfunction. So PPID is a much, much easier type of thing. And that's where the pituitary gland is not controlling the hormonal system properly anymore. So it's affecting the insulin, it may be affecting the adrenals, and we usually see high levels of ACTH. And then we have, every animal has Chinese medical imbalances. And most of all of us, people, animals, dogs, everything, when we look at things from a Chinese medicine perspective, and since I'm an acupuncturist and Chinese herbalist, I do look at this. And so what we'll see as animals age is that they very often end up with natural imbalances. And so we can actually treat those if we look at them from the Chinese perspective. And we have a big factor of genetics in here, because many of our animals are genetically very, very efficient at their digestive ability, their ability to get calories out of food. And if you look at places in the wild where horses live, very often those horses there's not a lot to eat. So you look at them in the winter, you go out west where the Mustangs are, there's not a lot to eat in the winter out there. You go to some of the places where the native ponies live in England, and there's not a whole lot to eat. So horses have evolved to be incredibly efficient. And that efficiency becomes a negative when we have pastures full of green grass, when we have highly nutritious food that we feed them. We recognize a laminitic event. Sometimes it's very obvious in that the horse will not move. But other times it can be a lot less obvious, and it can creep up on us in a subtle way. So some of the signs that we want to start to pay attention to is not that they won't move, but that they're reluctant to move. Maybe they're hanging back from the rest of the crowd. Maybe they're not the first one at the gate. Maybe you see them out in the pasture and everybody else is running around and they are not running, even though they sort of look okay, but they're just not moving the way they normally would. A lot of them have difficulty losing weight. They have fat pads. You may be trying to starve them, and yet they continue to gain weight. And part of that is the efficiency of their metabolism, and that's that genetic aspect. The less they get fed, the more efficient they have to be in order to survive. We can also look at their fat pads and the quality of their fat. And when the fat pads on their crest of their neck start to get hard, you know you're about to have an inflammatory event or some laminitis. We may see lameness. We may see one foot more tender than the other. Most of the time, we're going to see at least 2 front feet involved, and sometimes you'll see all 4 feet involved. This is especially true with a metabolic laminitis, but we can have one foot that's worse than the others, and that may make it look more like a lameness. So those horses might actually limp, and that might be our first clue. And then you start to feel pulses and you realize that you have pulses in both feet. They may be shifting weight from one foot to the other. And horses, especially with their front legs, don't tend to shift weight from one side to the other. They tend to stand square in front and then maybe rest one hind leg and maybe rest the other. Laminitic horses have a tendency to rock back and forth on their front feet. And you may also see them shifting weight off of their front feet onto their back feet and rear end. We may see some personality changes. We may see them getting grumpier with the other horses. We may see them getting more timid around the other horses because they know they can't move as fast. They may not want to be brushed. They may not be very comfortable. And this can be especially a clue if we have subtle signs that are not really obvious, but we see a personality change and maybe them not moving around quite as much. So we want to be looking at those feet. And the rocking back on the hind legs is also one of those clues. So Tessa is a rescued 20-year-old paint pony. She also got some COPD, and in this video, you can see that she is moving around, rocking back onto her hindquarters and turning very slowly and carefully. Not wanting to turn very well is another indication. And you can see as she begins to turn, if you watch the front feet, she really doesn't want to make a normal turn and weight herself. She wants to take careful steps. And it's because the sidewalls are also tender. It's not just about the toes. The sidewalls are also tender.
And so what if, I noticed this coming on and my vet can't get there? What can I do?
So there's a number of things that you can do. One of the things is to already have on board some holistic veterinarian, if you can. The American Holistic Veterinary Medical Association has lists of local veterinarians. If you have one in your area, great. Some of us do telephone consults. Currently, I have been booked full for the summer, but during the winter we may be able to take on some new clients. But there are others of us doing this kind of work, and one of the best resources is the Holistic Veterinary Medical Association. And on my website on harmonyequine.com, there are other organizations that have acupuncturists and homeopathic vets, and get one of those on board before you have a crisis if you can, partly because many of us are booked up and you can't always get an immediate appointment. There's not enough of us to go around, unfortunately. So the common thing that you may have in your barn is some anti-inflammatories. Banamine has a tendency to be a little more effective in a laminitis case, and certainly right away. use what you have. Icing is a little bit controversial, and in the acute case that just got left out on the field when they weren't supposed to be, or they got into the grain room horse, icing for the first 48 hours does make a difference. In the metabolic horse, we don't usually know that it's happening until after we have a problem. In other words, we have soreness and pain, and their icing is probably not the best thing to be doing. Homeopathic medicines are excellent things to have on hand, and they can be used right away. The homeopathic remedy Nux vomica is an excellent remedy. It is for overeating, and many times what has triggered our metabolic laminitis horses is either just a little bit extra grass or just a little bit too rich hay. They already have a metabolic problem, and it's just one extra bite of food that tips them over the edge. Nux vomica is a great way to get started. Belladonna is another remedy that you can give when you've got really strong pulses. There are all kinds of boots on the market, and if you have boots, you can absolutely put them on and use them, and we'll talk about some other pads in a minute. But if you don't have boots, it's obviously not going to be your immediate response, but there are ways that you can have something to respond to. The key is to figure out what makes your horse comfortable, because if what makes your horse comfortable is support on the back of the foot, which is the most common, then you know that you've done it right. If what you put on the bottom of your horse's foot makes them a little bit more uncomfortable, you know you have it wrong. So you need to change it. They will tell you what to do and what kind of padding they like on the bottom of their foot. So there are Surefoot pads, which my friend Wendy Murdoch has made. If you have a set of those, you can use them immediately. I find a lot of times that the slanted pads work well for the laminitic horse, but you can ask the horse if they're comfortable on any of those pads if you already have them, just depending on what you have. If you don't have them, again, it's not an immediate response type of thing, but it is something that can be quite useful to have in your arsenal of longer term treatments. The homemade pads, we can use some styrofoam, and good old-fashioned styrofoam that's sitting out in the barn. The Blue Builder's styrofoam is usually the best thing to use for most large horses. You can use the pink styrofoam for your ponies and small horses. It's not quite as dense as the bigger styrofoam. And all you're going to do is put your horse's foot on it, and then you can go back and cut out the shape of your horse's foot. And this website will take you to a site that has some excellent information, and it's got videos on how to make the styrofoam and how to adjust it. And the beauty of the styrofoam is that you usually have to buy a nice big sheet of it. So if your horse doesn't like what you've cut out the first time, you can change it very, very easily. And that is a fantastic thing, to just have a piece stuck in the back of your barn, and it's there for a crisis. It's incredibly valuable. So the other thing that we need to do is to get them off of whatever grass they might be on And many times our metabolic horses creep up on us. They're turned out with everybody. They're doing okay. We've been riding, we've been doing things with them, or maybe we've been ignoring them because something else is happening in our life. And that certainly happened to me this winter. I was dealing with my mother being ill, and my horse was sitting there with her head stuck in the round bale 24/7 without good support with her supplements and without some kind of confinement away from 24/7 stuffing her face. So life happens. So sometimes we've been riding a lot and the horse has been doing just fine on grass, and now we're not riding because we sprained our ankle or because work commitments or whatever. And suddenly the horses are getting more food than they need. So one of the first things that we would want to do in that case is to take them off of all of that green grass. We want to restrict their eating, but we don't want to starve them. And that's part of the purpose of the holistic approach, is so that we don't have to starve these horses. In confinement, we can use slow feeders to slow down the amount of hay they're eating. Maybe we weren't doing that before. That's another way of confining the amount of food they're getting. If we're putting them into a stall or a corral, in a perfect world, sand works beautifully. But not all of us have sand or can bring in enough sand to fill up a stall or a paddock. Sawdust is probably next in line, because the true sawdust, not those shavings, but the true sawdust will conform to the bottom of their feet. And in a similar way to sand. If you're using wood shavings, sometimes you think you want to bed them really deep, but that might actually be harder for them to find a comfortable position to stand their feet, a comfortable angle, because the shavings tend to ball up under their feet and be less controllable than sawdust.
And long-term treatment.
So long-term is what we really want to know about. And we have our standard allopathic approach. One of the most common things that I see people doing is to put the horses on thyroid medicine to get them to lose weight. And that's something that we need to sometimes take a step back and think, is this the primary problem? And in many cases, it is not. The steroids, the thyroid does have some benefit, and some of these horses are low in thyroid. But to just put them on high doses of thyroid to get them to lose weight, I'm not sure is very comfortable for the horses. Think about drinking too much coffee. If you're taking too much thyroid medicine, it can be like running your days on an excessive amount of coffee. Not the most comfortable way to lose weight. And we run the risk of the thyroid medicine slowing down the thyroid even more, because the thyroid gland then starts to say, well, I've got plenty of thyroid here. Why do I need to make more? So then it becomes more difficult to actually get them off of the thyroid medicine later on. Part of the allopathic approach is starvation, and is like, well, put them in a paddock and just give them 2 flakes of hay a day. The problem with that is that, one, we keep slowing down that metabolism more and more, and 2, we are stressing the horses, and stress itself increases insulin resistance. We know that from a lot of the human research. So stress is not in our favor, and besides which, our horses are miserable. And then the one drug that we have is Prosend or pergolide, depending on whether you're getting it in the commercial version or the generic version. And it is a very uncomfortable drug. A lot of horses have severe side effects from it. There are some horses that do very well on it. I prefer to save it for if things are not working, we can put them on it for a little while. Or maybe by the time they're 28 or 30 years old and the holistic stuff really can't help, maybe that will help. But for some horses, the side effects are just not worth it. They get grumpy. I believe that they get headaches. People talk about brain fog. They just don't seem to be as present. Their appetite often goes away. So it's a really unfriendly drug. And my goal in working with them is to try and get them off of it if I can. And usually we can succeed. With the holistic approach, which is what I prefer to work with, is acupuncture is a brilliant part of the program. And if you have an acupuncturist in your area, it's really good to have acupuncture done on a semi-regular basis, depending on how much work your horse is doing. And if you're having any issues, having an acupuncturist coming in and checking in on the horse from that Chinese perspective is really, really beneficial. Acupuncture is also beneficial in the acute laminitis cases. So in that first few days, it's amazing how much pain relief they can get from acupuncture. I use a lot of Chinese herbs, especially in our chronic insulin resistance and PPID horses, because I find that we need that long-term support because these imbalances have accumulated over the lifetime of the horse. There are many, many supplements on the market that claim to help with insulin resistance, and many of them do help quite a bit. And there are also supplements that can help with the PPID horses. My goal with supplements is to actually help change the metabolism. And this can be done. So supplements like my OB formula that's on the website or INR there's ingredients like magnesium and chromium that we've heard a lot about. And sometimes that's all you need is to supplement some magnesium and chromium. But there are other minerals, vanadium being one, that some horses respond to really well, and they don't respond necessarily always to chromium, and they don't always respond to vanadium. This is one of the things about natural medicine, is that not every horse responds to every treatment. So some of the supplements that we can give actually can change that metabolism, make the cells more permeable to insulin, improve the circulation or improve the function of the pituitary gland, and actually improve the circulation in the feet. Many of the supplements contain a lot of cinnamon, and cinnamon is something that can be very useful in insulin resistant horses, but it's a very warming herb. So it's fine for the older horses, but a lot of our younger horses don't need any more warming up. They're already warm inside. And from a Chinese medicine perspective, we look at warming and cooling. So the old horses are often a little bit colder inside, and they can handle some of the cinnamon. Hemp with CBD in it can be very useful for pain control. It's very anti-inflammatory in its working. And horses take to it readily. And we've been hearing lots about hemp. Just drive by 7-Eleven and they have CBD listed on their things that they have inside. I really would not buy any CBD from 7-Eleven because there are lots of issues with processing. You really want to know where you get it from, and you want to know that it's organically grown, because hemp is a fascinating plant, but it will extract anything toxic out of the soil. And you want to know that it's been organically processed because you don't want any chemicals in the extraction process. But that is, and there is early research in the human world showing that it can help with insulin resistance and diabetes. But the research is still early because there are also some studies that show that it may not. So we have to look at each individual case and we have to keep up with the research. And I'll be posting information on the Harmony Equine site about working with hemp. Red light therapy of various different sorts can be useful. A lot of people now have some kind of red light therapy in their barn, whether it's a true laser or whether it's a different wavelength and red light. And the red light therapy, what you need to do is to look at the instructions for acute for the first week, acute inflammation, and follow those instructions. Doing more is not necessarily better. You follow the instructions on your instrument and don't do extra. Cold lasers are wonderful tools. They tend to be quite expensive forms of light. And again, follow the instructions on your particular unit for an acute inflammation for the first week or so, and for chronic problems after you've passed that sort of 7-day, 10-day mark. Magnetic therapy can be very useful. The key with magnetic therapy is to use magnets that have south pole for that acute phase, which is about the first 7 days, and then to use the north pole for the chronic phases. You really do not want to be using bipolar magnets. You want to select which pole to use on a particular magnet. Yes. So here are a couple of links to some articles that I have written about laminitis and have more details than we have time to go into in this particular webinar about dosing and about specific details of supplements. But these will get you started. Again, my Harmony Equine site. We have lots of information. We have webinars on my YouTube channel, and some of those go into quite a bit of detail. So you can learn about spring and fall grasses and how to graze them. You can learn more about laminitis and get a ton of information from there. And we will be doing more webinars hopefully over this whole winter to keep you all interested and informed. We have sources to purchase safe CBD products. This is probably the primary one I use with in the horse world, and in the small animals, use a lot of the Well Pet dispensary sites. So now, are we about ready for some questions, Steph?
Yeah, we have some really great questions. How do you care for a horse that is overweight, has mild laminitis, and testing shows insulin resistance?
A good simple summary of approaching that type of horse is to look at a supplement for insulin resistance, which would be like the CBD. And in reality, OB formula would probably be where I would start. If you already have some discomfort, I would add the CBD. But OB formula, muzzles can be great if your horse is muzzleable. There are horses that really hate muzzles or that rub them off on every tree branch and fence, or hire their friends to remove them. And I have a really nice humane muzzle on the website. Limiting grass, and sometimes you need to use a dirt paddock. If you don't own your property and have a dirt paddock, electric fencing works really, really well. Horses are very responsive to it and don't tend to run through it. So you can cordon off a small area for grazing. And and try to increase exercise if you can. And that's not always a possibility in combination with life, the age of the horse, our time frame, and the horse's actual soundness, whether it's from a chronic laminitic situation or whether they're retired from being worked because they've got some other problem.
Wonderful. Is there another question? Is there such a thing as subclinical laminitis? And if so, are the symptoms different than full-blown laminitis, and can it be cured?
Yes, subclinical laminitis definitely exists. And subclinical just means that it's not very obvious. It's sort of the subtle symptoms that we talked about earlier, not really wanting to move fully. If you're riding them, not really wanting to do an extended trot, not really wanting to land over a fence. And this is in horses that previously would do this. Very subtle signs, but there will be signs. And what you'll very often see if you've had a subclinical case and you didn't really catch it, but you also maybe weren't riding them and you didn't feel it, you'll start to see little growth rings on the horse's feet. And that indicates that something changed for a little while. There was some kind of an event in that horse's life. And that can occur if they have a fever from the flu. It can occur if you've changed their nutrition. Say you recently purchased them and you've turned them out on grass and they didn't used to have grass. Or you've started doing a bunch of really good supplements on a horse that you rescued. You'll see growth rings. So the subclinical laminitis is the best time to treat it if you have to treat a laminitis, because it's really just about supplementing them with usually something simple, sometimes even just some omega-3 fatty acids like some hemp or flax or chia seeds. But something like the OB formula, if you suspect you might have a low-grade laminitis, or you're thinking your horse is just a little more tender walking across the gravel than they used to be, that would be a subclinical laminitis, not jumping out in our face.
And you talking some supplements. Another viewer asked, do you have any nutritional or supplement recommendations for growing and increasing sole depth in a chronically laminitic horse?
That's a good question, because sometimes those horses can be a little bit difficult, especially if inherently they didn't have a great sole. You can definitely stimulate some growth with warming type of supplements. At times I've had some Chinese supplements that will stimulate blood flow. You can toughen up that sole with something like Venice turpentine. Turpentine is an old-fashioned hoof toughener that is actually a natural supplement, or a natural, not supplement, but a natural compound. And we don't tend to use that as much these days, but it is very effective. But when we actually are talking about growing sole in a horse that really doesn't want to grow sole, sometimes we need to increase our blood flow to that area that we can't do with just topicals. And one thing we could try here would actually be an assisi loop, which is some PEMF therapy. And the other thing that we could try is a new protocol that I have been working with that uses carbon dioxide, Cardiox, and it's called an airjector machine. We have an article on our website. We'll put that in the link with the slides. And that is, you put the horse's leg in a bag with carbon dioxide, put into medical grade carbon dioxide, put into the bag. And you do that maybe 2 or 3 times a week for a horse that just needs to grow sole. And you actually are going to be increasing your blood flow to the area, and you actually do increase the little blood vessels in the foot. And the research is showing some very, very interesting results with this. So it's an expensive form of therapy just for growing a bit of sole, but if you have a more severe problem, it is certainly something that you can consider.
And you touched on PMF, the Sizzy loop. Another viewer asked about, have you ever heard of PMF treatments for laminitis?
Yes, and the PEMF devices range from a really nice, simple, it's called an Sizzy loop, and it is literally just a loop. And you can put this over the horse's foot, usually the foot's on the ground, and tape it to their leg. You can put it in between the 2 feet and treat 2 feet at one time. And it's relatively inexpensive compared to, say, the Cardiacs treatment. An Assisi loop is a $260, $270 device. You can get it off my website because they only sell two vets or two clients. You can also go to the Assisi site itself, and they you just put in my name as the referring veterinarian, and they will sell it to you for that right there on the site. You can also, a lot of people have these Beamer PEMF machines, and there are many, many different PEMF machines. It's great technology. It's been around since the 1940s. And now that we have fancy computerized things, they have become very popular, but they have been around for a long time. And if you have or know somebody who has a Beamer blanket or any one of the other PEMF machines, it can be very, very useful. The Beamers cost a lot of money, and so it's not something that, I think they're in the $5,000 or $6,000 range. It's not something that everybody can go out and do, whereas the Assisi loop is something that is not difficult for people to have around. And they last 3 months, 4 months. Mine seem to last a very long time. And the treatment is about 15 minutes for any of them. You don't need to keep them on the horse for long periods of time.
All wonderful information. Unfortunately, it looks like we're running out of time. We really appreciate your expertise, Joyce. We just kind of touched the surface, it feels like. I know there's so much more for us to learn about laminitis and founder.
It's true. This is sort of a never-ending lifetime study, but this is just another piece of information, and hopefully that will help you with your laminitic or help you prevent laminitis.
Thank you everyone for listening, and we hope you will join us next month for another webinar with Dr. Joyce Harmon. In the meantime, be kind and stay healthy.